Welcome back to the muscles in regards to the axial body. The set of slides is part 2, and you can see from the heading of the first slide that this is the deep layer of the deep layer. So we say this is the deep layer of intrinsic or deep back muscles. So we're going to be going a little deeper than the ones we went through, which were the erectors. So they tend to be very short. They are rotary based muscles, so these have a big influence on rotation of the spine. There are 3 groups, and all of them are found deep within the laminar groove. Remembering that the laminar groove is the groove that is created by the lamina and the transverse process, a small groove in there. We'll be talking a bit about that in class as well. Collectively, they are called the transversal spinal muscles or the transversal spinalis group, and they originate from the transverse process of a vertebra and pass to spinous processes of the superior. The more superficial one is semispinalis. Then we have in the middle multifidus, and the deepest of the deep layer is rotatories. So we can see here in this diagram, here we have the vertebra, in this case the rib, to give us a sense of where things are. This will help us a little bit in looking at superficial to deep in regards to the muscles that we took in the last set of slides. So here we see iliocostalis, here the most lateral out at the rib angle. We have longissimus in the middle and spinalis very close to the spine. But these are considered to be the superficial layer of the deep layer. The ones we're talking about in this set of slides is this group of 3 here. They run deep into this laminar groove. So where the lamina, spinous process, and TVP all come to form this groove. Semispinalis, the most superficial, multifidus in the middle, and rotators is the deepest. So semispinalis, we said, is the most superficial of the 3. It arises from approximately half of the vertebral column. It is divided into 3 parts according to where they attach superiorly. So we see here how they all arise up, and they are the most superficial. So we see we have a semispinalis thoracis, cervicis, and capitis. They're responsible, semispinalis capitis is responsible for the longitudinal bulge in the neck near the median plane. Therefore, it sort of makes up the largest muscle mass in the posterior aspect of the neck. So the next time you're palpating the cervical area by the occiput, if you get a little more laterally out, more medially towards the medial plane, you'll find a very large mass there, and that represents semispinalis capitis. It arises from the transverse processes of C7 to T1, sorry, I missed that, and the articular processes of C4 to C6. They go to the medial half of the area between the superior and inferior nuchal lines on the occipital bone. So I'll repeat, arises from C7 to T1, and the articular processes of C4 to C6 to the medial half of the area between the superior and inferior nuchal lines of the occipital bone. Its function is to extend the trunk, neck, and head at the spinal joints when working bilaterally. It laterally flexes the trunk, neck, and head at the spinal joints unilaterally. And what I want you to realize is that this is a contralateral rotator of the trunk and neck at the spinal joints. So a bit different than what you might be used to. And its innervation is the dorsal rami of the cervical and thoracic spinal nerves. So the question becomes, why is it a contralateral rotator? If we look here on the diagram on the right, we see that its attachment actually goes from lateral to medial. So in other words, the medial aspect is going to move towards the lateral aspect in this configuration when the muscle is contracting, thus pulling the spinous processes closer to its attachments on the lateral aspect of the TVPs. So therefore, when the left contracts, everything will turn to the right. All right? Semispinalis cervicis is the next one. It arises from the transverse processes of T1 to T5 to the spinous processes of C2 to C5. It extends the trunk, neck, and head at the spinal joints bilaterally, laterally flexes the trunk, neck, and head when working unilaterally, and contralaterally rotates the trunk and neck at the spinal joints. Let me go back a couple of slides. okay, the semispinalis capitis also rotates the head. I now apologize, I don't have that there. It is a contralateral rotator of the head, whereas the, oh, sorry, I'm moving ahead here or behind here, sorry. Whereas cervicis rotates the trunk and neck at the spinal joints. So capitis rotates the head contralaterally as well as the trunk and neck, whereas cervicis contralaterally rotates the trunk and neck, not the head. And its innervation as well is a dorsal rami of the cervical and thoracic spinal nerves. So we see here is semispinalis cervicis here. And you can see now how when contracting, the spinous process will move towards the transverse process, thus causing contralateral rotation. Semispinalis thoracis, we're just moving down a little bit further, finds attachments arising from the transverse processes of T6 to T10 and goes up towards the spinous processes of T4 to C6. It too extends the trunk, neck, and head at the spinal joints bilaterally, laterally flexes the trunk, neck, and head at the spinal joints when it's working unilaterally, and it is also unilaterally a contralateral rotator of the trunk and neck. And it too has the dorsal rami of the cervical and thoracic spinal nerves. So here we are here. Here is the capitis, here is the cervicis, and here's the thoracis of semispinalis. You can see very, very tiny in the cervicis and thoracis, but very much more developed in the capitis form and covers a fairly massive area, again, when you're palpating that neck. Its actions bilaterally, I said, extend the head and neck and unilaterally rotate the head and neck toward the contralateral side. The next one deep in the middle is multifidus. It is divided into several bundles. It covers the laminar groove of C2 to S4. So it's pretty extensive. It runs the entire spine basically. And it is most well developed in the lumbar spine because of the amount of stress and work that it needs to do and the kind of forces that travel through there. So again, here we see multifidus here in the middle. We also see it here in the diagram. We're sort of running right here. Its attachments have 3 attachment areas. So the lowest is the lumbar region. It attaches to something called mammillary processes, not the transverse processes of the lumbar vertebra. We'll be talking about that when we get to the lumbar spine. It arises also in the thoracic region from all the transverse processes in the thoracic region. And in the cervical region, it arises from the articular processes of C4 to C7. And all of them go to the spinous process of the vertebra 3 to 4 segmental levels superior to where the inferior attachment is. So whether it's arising from a mammillary process in the lumbar region, a TVP in the thoracic region, or an articular process in the cervical region, it is rising up 3 to 4 segment levels superior to the inferior attachment on an oblique angle. So we sort of see it here, how it rises up. So again, I'll repeat to the spinous processes. So we see here the TVPs here to the spinous process, TVP to the spinous process. We see how it runs the entire length all the way down here on the diagram on the right. Its functions: it extends the trunk and neck at the spinal joints bilaterally. It laterally flexes the trunk and neck at the spinal joints unilaterally. And it too is a contralateral rotator of the trunk and neck at the spinal joints. It is very much a rotator more than anything than it is an extender and a lateral flexor, although it does provide some with that. Its innervation is a dorsal rami of the cervical, thoracic, and lumbar spinal nerves. Again, quite a variation because of how much it extends the entire spinal column. The deepest now is the rotatories. It's also known as a rotator muscle. It is very well developed in the thoracic spine where rotation of the spinal column is greatest. They are very short and they are the deepest found in the laminar groove. So we see all the way down in here, very, very deep. And we can see, now in the diagrams, you're going to see rotators longi and rotators brevis. We're not going to get that specific. We're basically going to be talking about rotator longi, how it rises up, but it is very, very, very deep in the laminar groove. Its attachment rises from the TVP, the transverse process of one vertebra, to the lamina, one or two segmentals superior to the inferior attachment. So some authors say 2, some say 4, but you get the idea of it. Lamina, 1 to 2 segments above where the inferior attachment is. So again, we see here from the TVP to the lamina, TVP to the lamina, TVP to the lamina. It's kind of removed here, so it's not quite as busy. You can see it arising here, TVP, 2 levels up to the lamina. Its functions is a contralateral rotator of the trunk and neck. It extends the trunk and neck of the spinal joints bilaterally, and it laterally flexes the trunk and neck of the spinal joints. Very minor, but it can do that. Dorsal rami of the cervical, thoracic, and lumbar spinal nerves innervate all the segments of this muscle as it works its way up. We do have 2 very minor back muscles I just want to speak quickly to, and their names probably tell you exactly where they're going to be. That is the interspinalis and the intertransversarii. They are very poorly developed in the thoracic spine, but very well developed in the cervical spine. So we see here is our rotators that we were talking about, longus and brevis. We look a little bit deeper here, we see our intertransversarii here and our interspinalis here. So on this side, here is our interspinalis, so a small muscle running from spinous process to spinous process. And here's our intertransversarii here, running from transverse process to transverse process. So its attachments then, interspinalis is from a spinous process to the spinous process directly superior to it. And the intertransversarii is from a transverse process to the transverse process directly superior. So these muscles are very short. They only run from one segment to the next. Generally, their function is to extend the neck and trunk at the spinal joints. The slight difference is interspinalis is innervated by the dorsal rami of the spinal nerves. Remember, this is the one that goes back. Whereas intertransversarii is more innervated by the ventral rami of the spinal nerves. In other words, this is a nerve that travels anteriorly away from the nerve as it exits the spinal column. You see here again, intertransversarii and interspinous here. What I want to talk about is something called levator's costarum. This is considered a back muscle because of its one attachment, but it is in fact actually a respiratory muscle. It does help in the movement of ribs when we're breathing. And so its one attachment is the transverse processes of C7 to T11 to the ribs 1 through 12 between the tubercle and the angle externally. So you can see that's from a TVP to a rib. Its basic function is to elevate the ribs at the sternocostal and costal spinal joints, generally when we're doing a very large forced inspiration. These work a little bit in normal breathing, but when we're relaxed and breathing, say such as sitting at a desk, that's pretty much all diaphragmatic work. This is used when we're taking a big breath in, maybe even when we're exercising. Its innervation is the dorsal rami of the spinal nerves. So we can see here how, again, if we go back to transverse processes here, we can see arising from the transverse processes to the outside surface of the rib between the tubercle and the angle. So we see it here in the diagram, how it works its way all the way down to each rib. Also in the drawing here, we can see its function as well. And so you can see how quite easily how the contraction does lift the ribs up. Thanks for listening to this slide. The last slide will be involved with muscles related to the thoracic cage and the abdominals. Thanks for listening.